Does the sound of someone chewing, breathing heavily, or tapping a pen make your blood boil? If so, you are not alone, and you are not overreacting. Before we begin, don't panic. This video isn't here to scare you. It's here to give you clarity, confidence, and hope. The information you're about to hear is based on medical evidence and could change the way you understand this condition. Stay with me until the end to discover treatments naturally and medicine's science-backed steps that can help you take better control of your health. Today, we're exploring the medical science behind our topic, misophonia, why certain sounds trigger intense anger or irritation. Misophonia translates literally to the hatred of sound. It is a neurobehavioral disorder characterized by a severely decreased tolerance to specific sounds, which are known as triggers. When exposed to these triggers, individuals experience strong involuntary negative emotions like extreme irritation, disgust, anxiety, and even rage. These emotional reactions are accompanied by a physical fight-or-flight response, causing your heart rate to increase, muscles to tense, and blood pressure to rise. It is important to note that misophonia is not simply being annoyed by a loud noise. In fact, the volume of the sound often does not matter. It is the specific pattern or meaning of the sound that sends the nervous system into overdrive. The brain chemistry behind the rage. For a long time, people with misophonia were told they were just being too sensitive. But modern brain imaging has proven that misophonia is a real neurological condition. Research indicates that individuals with misophonia have altered connectivity in the brain, particularly involving the anterior insular cortex. This is a region of the brain that processes emotions, detects threats, and integrates sensory input. When a trigger sound is heard, this area of the brain becomes hyperactive, signaling a false threat and instantly activating the sympathetic nervous system. Recent theories, such as the hyper-mirroring model, suggest that the auditory centers of the brain are also overly connected to the motor cortex, which is the part of the brain that controls mouth and facial movements. This means your brain is essentially mirroring the action creating the sound, causing an overwhelming physical and emotional reflex. Common triggers and Misokinesia. Trigger sounds are most often human-generated and repetitive. The most common triggers involve mouth and throat noises, such as chewing, lip smacking, slurping, heavy breathing, and throat clearing. Other frequent triggers include pen clicking, keyboard typing, and repetitive animal sounds like barking or licking. Interestingly, many people with misophonia also experience a related condition called Misokinesia, which means the hatred of movement. Misokinesia involves an intense, aversive reaction to visual triggers, such as watching someone shake their leg, twirl their hair, or even seeing the jaw movement of someone eating. If you have any questions, leave a comment describing your situation. Evidence-based coping and behavioral therapies. Living with misophonia can be disruptive, but there are several science-backed therapies that can significantly improve your quality of life. Cognitive behavioral therapy, or CBT, is currently the most thoroughly researched and supported psychotherapeutic intervention for misophonia. CBT helps patients identify automatic emotional reactions, reframe threat-based thinking, and develop coping skills to reduce avoidance behaviors. Acceptance and commitment therapy, or ACT, is another highly effective behavioral therapy that helps individuals build psychological flexibility, allowing them to accept distressing internal responses without fighting them. Sound therapy, often provided by audiologists, involves using ear-level generators to play continuous, low-level white, pink, or brown noise. This softens the contrast between the trigger and background silence, reducing the brain's hyperfocus without fully blocking out the world. Medical treatments and next steps. While the FDA has not approved any specific medications to cure misophonia, medical treatments can be used to effectively manage your physical symptoms and co-occurring conditions. For instance, beta blockers, such as propranolol, are being researched and used off-label to blunt the sympathetic fight-or-flight response. This helps reduce the rapid heartbeat and physical panic associated with trigger exposure. Additionally, because misophonia frequently overlaps with conditions like anxiety, depression, and OCD, doctors may prescribe SSRIs to help regulate underlying mood disorders and lower overall neurological reactivity. Reputable academic organizations, like the Duke Center for Misophonia and Emotion Regulation, are actively conducting clinical trials on new interventions, bringing us closer to even more targeted treatments. Any medication mentioned in this video should only be used under the supervision and prescription of a qualified physician. Do not self-medicate. Living with misophonia can be exhausting. But understanding the medical science behind your reactions is the first step toward finding relief. If you found this information helpful, please follow and subscribe to our channel to join our growing supportive community. Together, we can stay up to date on the latest medical research and empower you to take control of your health. As a doctor, I'll personally read your comments and do my best to answer your questions.